Howdy everyone, Madam Mateo here, coming at you with another orthopedic special test, and this one is for the SI joint. It is Gillet's test, or Stork test, or Gillet step test, or it's got a couple different names out there, but anyway, so the history of this test is kind of interesting. It was apparently developed by Dr. Henry Gillet and Dr. Marcel Liekens. Liekens, I think that's how you say it. Well, they were Belgian chiropractors who developed a system for palpation and motion assessment, specifically of the spine and pelvis. So there's not really like a definite paper to say like, this is the first mention of it. It seems more it was in their teachings, but they did put it in a book in 1981. It's called Chiropractic Research Notes, and that's kind of like the first formal discussion of this test. But anyway, let's get in on how to do it. To perform this test, you have the person standing and you are behind them. What you want to do, you want to palpate two areas on their spine. First off, the PSIS, so you place your thumb right there on it. Then you place your other thumb about S2. You place that right there. Then what you're going to do, you're going to ask them to lift the knee, bring the knee to the chest on the side that you have the PSIS. So we're going to say, hey, Mateo, this leg right here, bring it up to your chest. As he brings it up, we are looking at how much movement we get at that PSIS. So it should move down. So as you raise up, and if this hand is on the PSIS, it should move down. And then you can check the other side. So again, you're just seeing how much motion that happens. If you don't get any motions, it may mean that the SI joint is stuck or it's just very stiff. But anyway, that is how you perform Gillet's test. So getting in on the research for this test, it's kind of interesting. Now, keep in mind, this test doesn't look at things like dysfunction, pain, things like that, because it's not a pain provocation test. It's a motion assessment. We're looking at how much motion goes on. So you can't really look at things at sensitivity, specificity. We're looking more at reliability, validity. We're looking at those things for this test. And a lot more has been done in the reliability area. So how reliable is this with intra? So, you or me, or like I'm doing it over and over and over again, or inter, which we have a group of people, and if I test it, you test it, and Bob tests it over there, how accurate are we going to be? So there was one in 1987, it's one of the first ones that have done it. They looked at 53 college students and found the intra, so the internal reliability had a fair agreement. The inter, so with the researchers, was like a slight agreement there. So now they did do this again many years later in 1999, and they looked at 41 people, and they're saying, do you have symmetrical movement or asymmetrical motion? And they found that it was just poor intra and inter reliability as well. So you kind of got a mix. Now they did do a systematic review of like movement test in 2021, and they were looking at reliability and validity of a bunch of, again, SI joint movement tests. I got this all linked down below if you want to read it. And so looking at Gillet tests, they found that the kappa value of it for intra was a 0.46, which is a moderate agreement. So with all that being said, this test really just looks like if you use it and you're looking at movement, you're just wanting to see, is the SI joint moving? Is it stuck? Those things. And if it's you doing it, testing it on the same person over and over again, that the reliability is going to be better versus if you do it and then again, the colleagues do it and other people, you kind of get all over the place. But again, I think it goes down to just the interpretation of it. But anyway, and again, keep in mind, it doesn't lead to saying like, yes, that the SI joint is a pain provocator, is where the symptoms are coming from. It really doesn't lean into that. Again, it's just motion. So is it stuck? Is it not, or anything? Anyway, I've rambled too much. Let us know down in the comments. Do you use it? Do you like it? What do you think of this test? Of course, if you like the video, please hit the thumbs up button. Mateo appreciates it so very much. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.